Cutaneous T-cell lymphomas, or CTCL, are rare, potentially life-threatening forms of non-Hodgkin lymphoma that present on the skin, with a proportion of patients presenting with or developing extracutaneous disease. Mycosis fungoides, or MF, and Sézary syndrome, or SS, are the best-studied CTCL subtypes and account for around 2/3 of all cases. The Phase 3 Maverick clinical trial studied the comparative efficacy and safety of Mogamulizumab and vorinostat in treating patients with MF and SS that had failed one prior systemic therapy. In Maverick, patients experienced significantly superior outcomes following treatment with Mogamulizumab than with vorinostat, including progression-free survival, overall response rate, and impact on patient quality of life. However, it was not clear what effect, if any, blood involvement, an independent negative prognostic factor, had on patient outcomes following Mogamulizumab. To address this question, an international group of researchers performed post-hoc analysis of Maverick data, examining drug efficacy and safety outcomes among patients with predefined, that is, B0, B1, and B2 levels of blood involvement. They found that while Mogamulizumab conferred better progression-free survival and objective response rates than vorinostat across all groups, the differences were most pronounced in patients with B1 and B2 levels of blood involvement. In addition, Mogamulizumab significantly prolonged the time to next treatment in these two groups, indicating a more sustained response. Furthermore, the number of patients achieving response in skin, defined as 50% or more improvement in mSWAT score, was greater for Mogamulizumab than that for vorinostat and occurred most often in patients with blood involvement. While the frequency of adverse effects remained unaffected by level of blood involvement, it was relatively lower for patients receiving Mogamulizumab compared to vorinostat treatment. Together, these data suggest that in Maverick, Mogamulizumab provided better clinical outcomes than vorinostat, especially in patients with blood involvement.